Hello, everybody. I am so glad that you're here right now, and I wanted to welcome you to We Care Solar's panel, which is on clean energy for health, a gender equity approach. I'm going to give a moment for people to finish coming into the room, but we're really excited to be with you today. We have a wonderful panel. Actually an international panel of health workers, solar installers, women's leaders, We Care Solar leaders to really share with you the work that we have been doing that is at the intersection of clean energy, healthcare, climate action, and gender equity. So my name is Dr. Laura Stachel, and I am the Executive Director and co-founder of We Care Solar. And today we're gathered to try and address this question. How are women enabling women to access health care in a world where 1 billion people are living in communities where health facilities lack reliable energy access or have no energy at all? We know that there are 100,000 health facilities in Africa alone that either have no energy at all or that do not have sustained power. And as a result, women, particularly childbearing women who cannot control when they go into labor, are receiving suboptimal care, or they're being turned away from darkened health facilities, or they're suffering complications because of the lack of light and power. For 15 years, We Care Solar has been trying to address this often overlooked problem. And today we're here with our partners to be sharing our efforts to achieve gender equity in this space. The panel that we have include a keynote by Maame Afon Yelbert-Sai, who is a renowned women's leader and also the chair of our board. We're going to have a panel that is moderated by Debbie Kadu-Sirwada, who is also a women's leadership expert from the University of Wisconsin in Madison. And then we will be having some of the leaders from We Care Solar, including our managing director, Samantha Parsons, our Nigeria country program manager, Dr. Julie Yemi Jonathan, and then some of our amazing partners, including midwife and nurse practitioner Sarah Namyalo from Uganda. And we have two solar electric installers and STEM experts themselves, one from Nigeria, Gloria Jola Ngozi, and also from Kenya, a photovoltaic expert, Helen Mburu. And they'll be providing their own introductions in just a moment. But at this moment, I wanted to pass the baton to Maame. Maame will be giving us a keynote. And I'd like to invite all of you as well, while we're talking, to be putting your own introductions into the chat. We'd love to know where you're coming from and the work that you're doing. And then as the panelists are speaking, you can also be putting comments and additional questions, including in the question and answer space. So Maame, welcome. And thank you so much for giving us a keynote today.
Thank you, Laura. And it's certainly a joy to be in this space. I believe in the power of gatherings. And I believe that when we gather, there's something powerful that happens. We learn, we listen, we are inspired, and we are able to walk away with tools and skills and the motivation to really deploy and take action. I have just returned from New York, where CSW69 is still happening, and it's going on through March 21st. Being in New York, women from all and sundry have gathered to take stock and examine the progress, the gains, and the losses that we have seen over the past 30 years after the Beijing conference. And in New York, I had the opportunity to sit in various sessions and various conversations. And, these conversations were really an intergenerational space that we created. And we created these spaces to tease out and highlight lessons from the past 30 years and also to chart the way forward for the next 30 years. And as I think about what we are doing to chart the course for the next 30 years, one thing that rings true, and it became very clear as we were having conversations in New York, is that we should prioritize wellness and joy in our work, in the form of personal care as well as collective care. Our personal care should fit into the collective care. You may be wondering, Maame, what has personal care and collective care, what has that got to do with anything we are talking about? We are here talking about sustainable energy. It has everything to do with it. It has everything to do with it because we know that it has taken us a lot of work to be where we sit today. What we have done to bring us here today, where we have gathered as a community to hear, learn, and share about the meaningful work we are doing at We Care Solar, it's going to require us to really sit in that joy and personal care. And if we are going to think about what the way looks like and what the future looks like, care and joy will be also very relevant. So let me talk a little bit about what we are doing at We Care Solar and the context in which we find our work. For us at We Care Solar, we know and we are aware that the bold, audacious, and sustainable future we envision to light every birth will require tons of clean and joyful energy to fuel us. Our work at We Care Solar sits in these contexts. In fact, a joint report by the World Health Organization and the International Renewable Energy Agency indicates that globally, 1 billion people are served by healthcare facilities with no or unreliable electricity access, impacting essential services and universal health coverage. And then I want to bring my personal experience. So based on my personal experience, directly, I'm delivering my twin daughters and my son in safety and with care over 18 years ago and 16 years ago, respectively, along with my work at the Global Fund for Women, where we mobilize resources and put it directly in the hands of midwives, women who find themselves in rural communities, women in Francophone, Lusophone countries, who don't have access to adequate and relevant resources, or even women who are in post-conflict regions, who are not able to access the right resources to do their work. I know that our work at We Care Solar is so important, given this context that I have just described. I believe that, and I know that firsthand, in the first-hand process, our work is sitting at the intersection of gender equity, addressing the impact of climate change, amplifying women's leadership, promoting economic empowerment, and ensuring access to clean and sustainable energy. These big themes I have just mentioned are all high on the agenda and on the table as we look at the next 30 years after Beijing. Our current global context really is a little perturbing, it really makes me sit back and I'm like, where are we? Where are we going? But what we know and what I know, and even being in New York and having several conversations, we are aware that the gains and progress we have made is at stake. And it is important that we double down, triple down, quadruple down on our efforts to ensure gender equity in access to quality and timely healthcare for women and girls. What I know also is that we have an incredible opportunity to redefine, innovate, and reimagine the future we want by deploying the power of collaboration, by deploying the skills, the expertise, the lessons we have learned from the past 30 years to formidably forge ahead. What I also know is that we need to multiply our efforts to strengthen inclusive and trust-based philanthropy and funding to push forward our work. For us at We Care Solar, these things are all important. And we look at a holistic, integrated approach to bringing this work, this formidable work to life. For the past 15 years and growing stronger, we at We Care Solar have been developing solar-powered solutions to address energy poverty in healthcare with a keen eye on maternal and infant healthcare. In this time frame of our work, in this time frame of our existence, our work has supported and enhanced maternal health outcomes, supporting about 10,000 health facilities. And this translates into 18 million mothers and newborns really being served by our work. That is something that I am proud of. You know, every time I answer to the call of being a part of the board as board chair, these are the things that keep moving me. These are the things that keep fueling me. We know that our work is crucial. And we know we must continue because lives are depending on us to light every breath. So I'm going to leave you with one quick question. I want you to ponder that for a moment as we get into the panel and hear, direct stories from the ground. The question for you is, what can I do to brighten and light up the corner where I sit? What can I do? And I say I because the I's now really merge into the us. So what can I do? And collectively, what can we do to brighten and light up the corner where we sit? You're going to be hearing amazing stories. And I want you to sit tight, relax, and feed your soul, your mind, and your spirit. And I invite you to join us in the amazing, incredible work we are doing at We Care Solar to light every breath. Thank you all.
Wow, wow, wow. Thank you so much, Maame. Thank you so much for your warm welcome. And that's a very powerful question. What can I do to brighten and lighten up the corner from where I sit? That is very, very important. And this is just going to take us directly into our panel discussion. And good afternoon, good morning, good evening, everyone. My name is Debbie Kadu-Serada. I have the honor of serving on the board of We Care Solar. I wear many hats. I am the Africa Director of the Leadership Circle of a campus-wide Women and Wellbeing Initiative at the University of Wisconsin in Madison. And there's so much else to me, I don't have time to exhaust that. It's really, really an honor to moderate this very, very special panel discussion as we reflect on clean energy for healthcare through a gender equity approach. It's also significant, as we're all aware, that we're marking 30 years since the Beijing Platform for Action, the most comprehensive blueprint for advancing gender equality worldwide was actually came into place. As you may recall, in 1995, global leaders committed to ensuring women's health, economic empowerment, and environmental sustainability. Yet today, as both Laura and Maame have already pointed out, millions of women still lack access to safe maternal health care, simply because health facilities lack electricity. So this is not just an energy problem, it is a gender justice problem. So today, it's really my honor and we're privileged to be able to hear from the thought leaders, the practitioners, the change makers who are working in the We Care Solar space to bridge this gap. We will explore how clean energy is transforming maternal health care, how women are leading in the clean energy sector generally, and of course, that very, very big question, what still needs to be done to achieve true gender equity in health and energy? So I have an esteemed panel of discussants, and I'm going to invite them to introduce themselves. We have Laura.
Hi, I'm Laura Stachel.
Executive Director. So over to you, Laura. I would like each one of you to introduce yourselves and share in 1 minute how you became involved with We Care Solar. A little bit of your why.
Thank you, Debbie. I'll be talking about this more in a moment, but I worked as an obstetrician gynecologist in the United States for 14 years before turning my attention to research in Africa about maternal mortality. And it was while I was doing public health research in Nigeria that I was introduced to this issue that has now become the passion of my life, this issue about electrification of health facilities for the provision of healthcare for women. And I'll be talking about that more later. So I'm going to keep myself very brief and pass the baton to Samantha.
Good morning and good evening, everyone. I'm Samantha Parsons. I'm the Managing Director for We Care Solar. I have been managing international development projects for 25 years and many across Africa, where much of my passion has been fueled. I believe that gender equity is at the I feel extremely fortunate to be with We Care Solar, where gender equity is one of the most important things we do across a variety of levels. And I think today we'll have the opportunity to hear from all of our panelists and women who are involved in the various levels of the projects and how they are furthering gender equity in the work that we do. So I just am very grateful that all of you are here to hear their story and to hear more about how women are involved across the entire spectrum of our work. So I'll pass to Julie because she's right down below.
Hi, everyone. Yes, so my name is Julie Yemi Jonathan. I'm the country program manager with We Care Solar in Nigeria. So yes, I'm a medical doctor, but I always like to say that it is my passion for seeing positive outcomes for maternal and child health care that has brought me to We Care Solar. And it's always very fulfilling to see the faces of the healthcare workers and the mothers and even the community just light up whenever we light up the labor ward and the facility. It's always very fulfilling. It keeps me up at night and it just makes me also sleep well at night. Thank you. So Engineer Gloria, over to you.
I'm Engineer Gloria. I'm an engineer and principal lecturer with the Federal Polytechnic Bauchi, and also the MD ING consult, and currently the female team lead for We Care Solar Light Every Bird program in Bauchi State. How I became involved with We Care. One of my PG students linked me up with Dr. Julie, who is the CPM for We Care Solar. Thank you.
And who are you passing it on to? Sarah?
Hi, everyone. Yes. Sarah Namiari is my name. I'm the president for the Uganda Private Midwives Association. I'm a midwife by profession. I'm also a reproductive health specialist. We partnered with We Care Solar some years ago in 2016 because we have private individual maternity for across the country in Uganda, where sometimes power or energy is a problem. So we are so grateful for We are so grateful to Solar We Care because you really identified us as a key partner in this space. Thank you so much.
Helen. Hello, Helen.
Hi, Debbie. Hi, everyone. My name is Helen Buru from Kenya. I am a renewable energy consultant and trainer, but I am also a trained solar photovoltaic installer with the We Care and We Share Solar. I am here in this space because I attended my first ever female-only training in solar PV installations, and it was an amazing experience, and that has led me to do installations that have impacted well over 1,000 students and women and girls in schools and in a number of hospitals as well. So I'm really grateful to be here.
Okay. So this is great to hear from everybody, and I now hand over the mic to you, Laura. So what are the challenges that pregnant women face in accessing maternal health care in the global South that led you to co-found We Care Solar?
Well, thank you. Thank you so much, Debbie. And thank you all panelists for being here. What really led me to co-found We Care Solar was having the experience of working in northern Nigeria in a state hospital that was serving 1.5 million women and trying to understand some of the factors that were contributing to some of the highest maternal mortality rates in the world. At the time when We Care Solar was founded, 500,000 women were dying from complications of pregnancy around the world every year, and Nigeria was one of the highest contributors to that statistic. And there are a lot of factors that contribute to high rates of maternal and also newborn death. And part of that is that the women themselves who are seeking care may not have good prenatal care, they may not have good education, they may not have the luxury of accessing health care on a regular basis. They're quite poor and don't have resources to really get them to the care when it's needed. But what I was studying is what was happening to women once they actually arrived in a health facility. And I anticipated before starting this research that there would be a number of things affecting care, such as limited staff members and limited equipment, problems with infrastructure, maybe problems with medication. And all of those things were true. There were really a lot of issues that made the care that my colleagues in Nigeria were providing very different than the care that I was used to in the United States. They were definitely not having the same kinds of resources. What I hadn't anticipated was that even a hospital serving 1.5 million people could be without electricity for 12 hours or more every day. And what I experienced in those days was women that were literally turned away from health facilities at night when they needed things like emergency cesarean sections because there was no power. I was in operating theaters when the power went out during cesarean sections and people could only finish the surgery by flashlight. I saw midwives and nurses trying to provide care using candles, using kerosene lanterns, struggling to provide even basic care. And it was so challenging for everyone involved. It was demoralizing for the health workers. It was frightening for patients. And it was while I was observing care in labor and delivery, watching women who would normally in the United States be in intensive care units because of the complications they were suffering. And here they were in a room in sheer darkness on a metal table without monitoring, without light, without some of the basic provisions that you would normally give to women with complications, that I recognized that women were dying in silence in these conditions. And that was about 2008, and it led me on a journey to bring power. My husband at that time was teaching about solar electricity in the United States, and he designed a solar electric system for the operating theater and the maternity ward in this hospital. And at the time I arrived at the hospital 3 to 8 women were dying every month from complications of pregnancy. And when they received the solar power, maternal deaths went down by 70%. And many facilities came to meet with me and say, can you also bring us solar electricity? And we realized we needed something that could scale. So we started We Care Solar to bring rugged, compact solar electric systems to maternal health facilities, first in Nigeria. And then later we started realizing that the problem we were seeing in Nigeria was actually a much larger problem in the global south. And so we began also creating programs to bring solar electricity to health facilities in many countries around the world. And as Maame mentioned, we've now reached more than 10,000 health facilities. One of the things we saw early on was that women could play a very significant role both in designing programs and also being the people trying to solve the problems. And I know that we'll have a chance to hear from many of the people that are working on solving these problems over the next hour or so. Thank you.
Thank you so much, Laura. This is very powerful to hear from you and to understand how that aha moment, ignited something in you and just propelled you into this amazing leadership action. So I would like to turn over to Julie, because Julie represents that country that kind of like brought your attention to this need and spurred you into action. So it will be interesting to hear from Julie as the country program manager in Nigeria, to understand how you've seen this challenge work out in your, in your work. How is this manifest in northern Nigeria, and what is the impact so far?
Thank you very much, Debbie. And it's always very interesting to hear Laura's story. And I say the story every time I meet with governments, with stakeholders, even the community people. I say it every time. It's always interesting to hear that little spark has grown to what it is today. So yes, for us in Nigeria, of course, it's not peculiar to us that we have power poverty, which is lack of reliable, affordable power, especially in the health facilities. And in Nigeria, we have about 82,000 maternal deaths. And the northern part of Nigeria is giving us over 1,000 out of 100,000 live births, which is really large, like it's very high. But for us, yes, we understand this problem, and we started with Kebbi State, and I remember very vividly sitting down in that room I was the only female in that room. I sat down there with all the stakeholders, with even some health partners. And then I presented our Light Every Birth. I introduced our project. Everybody was truly intrigued, and they were like, yes, there is a problem, and this would solve some part of the problem. And then I dropped the information to say, oh yes, we're actively looking for female installers. And there was this dead silence in the room, and everybody began to look at themselves like, did I hear well? And then I heard one voice say, our women are not allowed to do such jobs. And quickly, I understood where I was sitting. I understood the context of where I was sitting. I understood that I was in a very conservative setting, in a very religious setting, in a place where women are really not given the free will to do such career. They are told to be at the back end. And it didn't deter me. We began the installations in Kebbi State with an all-male team. And then lessons learned from Kebbi, by the time I moved to Bauchi, which was our next Light Every Birth state, I began to think, what can I do differently? And I began to ask questions. Do we have technical schools in Bauchi? Do we have female lecturers? And then I met Engineer Drola. I made the same presentation to her, and she was just excited about it. And I was like, we can do this. I need you to look back into your directory and look out for your ex-female students, which she has very few of those because women are also not allowed, or they are not, commonly allowed in the northern part. So she had very few. She showed me a list and I told her, can you rank this list? She ranked it and I reached out to them. And it was interesting that they were all very interested in being part of our Light Every Birth. And today it is also more fascinating that from 0 to 6 installers in our classroom to 10. Right now we have 10 female installers recently trained, and we're looking forward to having another all-female team in the FCT. For us, I think I'm super excited because the FCT is the melting point of Nigeria, is the showpiece. Like everybody would come and see what We Care Solar is doing in its Light Every Birth in trying to empower women. Because for me, I believe that women, they understand the urgency of delivery, of childbirth, and they are in the best capacity to be able to provide this gender transformative service. Thank you.
Wow, that is powerful. You have 10 female, we have 10 female installers
Yes,
in
we
region.
in the FCT.
Oh my God, that's amazing. And I just like listening to the power of sisterhood, of engaging Engineer Gloria and inquiring, and look at the ripple effect of that. You know, when women move forward, the world moves forward. This is incredible. Okay, so I'd like to turn to Samantha. Samantha, why is gender equity so crucial in your experience to the context of clean energy for healthcare, particularly for maternal and newborn care?
Thank you, Debbie, and thank you, Julie. I think what we look at and the framework that I apply most to the work that we do is that access to safe childbirth is a human right for women and girls. So by bringing safe childbirth, we bring dignity to women and girls. And it's dignity to women delivering, and it's dignity to the health workers that are assisting with those deliveries. By improving energy access from birth, we're impacting women and girls on multiple levels. And I think we have the opportunity to really work with women at those multiple levels, improving skills acquisition, as Julie was speaking about, with installers, improving health worker morale for those that are delivering in very difficult conditions, some that are delivering hundreds, 500 to 700 babies per month in their facilities. And it's such hard work that the health workers are doing, and being able to provide more assistance and giving them such capable technology to improve safe childbirth is really providing more dignity for each and every woman and girl that's involved in maternal child health care. So that's what we're most excited about, or what I'm most excited about. Thank you, Debbie.
Mm-hmm. That's a powerful reminder. It's just about a fundamental human right. It's about our dignity for the woman giving birth, for the care providers. Thank you for the reminder. I'd now like to hear from Engineer Gloria and Helen at this juncture. So what barriers exist for women entering the solar energy workforce?
Okay.
Gloria first.
Okay. For women entering the solar energy workforce, one of the barriers is the gender stereotype. The assumption that women are weak and that only the men are suited for such jobs, for energy career jobs, for any solar energy career. And then lack of female role model is another barrier. And then I see limited access to education and training. Very few women are willing to participate in STEM program, which are the core courses for the solar energy industry. And then the work-life balance. As you agree with me, the solar sector is very demanding. And so it makes it difficult for women to balance work and family responsibilities.
Thank you so much for sharing that, Engineer Gloria. Female role models are not as many as we would like to have, but We Care Solar is investing, and slowly we're going to build that, community of female role models in this arena. And work-life balance, yeah, that's something we all grapple with. Helen, what's your experience? Is there anything else?
I think, thank you, Debbie. Gloria has mentioned quite a number. I think the one thing I want to probably just comment on is because of the unique setting because of our social cultural context where STEM courses are usually preferred for men and boys rather, and boys are encouraged to take up those courses. It means that when a lady is interested in STEM, or they're actually in a class and they want to learn about whatever type of renewable energy it is that they want to learn, or STEM, that because of the context they're coming from, they may need more moral support to encourage them to learn. By this, I mean that we just find, like, when, for example, I am training other women in this field, in the solar PV field, that I need to encourage them more with very simple things like, let's go on the ladder together. Let's get onto the roof together. Don't worry about your shoes. Next time you will get safety boots. Stand like this on the roof. You can do it. Don't look, slowly by slowly, getting them to build confidence in themselves. And this very person that sometimes starts with you very shy and very hesitant to take on tasks, after they do 2-3 other installations, sometimes you cannot believe it is the same person you were with, who you were encouraging to, just climb onto the ladder or hold a drill a certain way. So I think just learning that because of the cultural context that many women are in, when STEM courses are being taught, we may need to encourage, we may need to give more moral support to help them learn that much faster. And also, I think, let me also just mention this. It would be fantastic if the classes are in such a way that the ladies are given space to just learn amongst themselves. I think I can comment on it later, but that's what I wanted to add on to what Ngozi has said.
Okay, did I hear you right, to kind of have like all-female learning environments? Was that it? Helen?
Yeah, I think, not to preempt it, but I think one of the best ways we can encourage women to join STEM is to have female-only classes. And I can share my example later on of what that did to me the very first time I stepped into a female-only class. Yeah, so I'll just hand it over back to you.
Yes. Okay, I get it. It's actually linked to the whole socialization, the way girls and women are socialized, and that comfortable space, that safe space, creating those safe spaces for women to learn, is coming through, and it actually has direct implications also for family rearing practices. How are we raising the girl child? What is the message as mothers? And even dads, grandparents, everybody in the family, what are the messages that are being sent to our little girls as they grow up? Thank you so much, Helen. I would like now to hear from Sarah. Sarah is a midwife, and so she has that direct experience of bringing little babies into the world. So what has the impact of the Light Every Birth initiative been on the women you serve? Can you share any story of a mother or newborn or healthcare provider whose life was transformed by the work of We Care Solar?
Thank you so much, Debbie, for allowing me to say something about this. I'll start with our stories in Uganda. Currently in Uganda, our maternal mortality ratio is actually high because we lose many mothers due to different causes and contributing factors. Missing life at birth, missing light at birth can be a very vital issue, because as we conduct deliveries to ensure that, you know, the mother and the baby is safe is really paramount. But sometimes when we miss light during that service delivery of bringing life to this world, we lose babies and mothers. So I can share a story. One time, actually, late in the night, I received a mother, and this mother was in second stage. Examining her, she actually had a breech presentation and the power had gone off. She's presenting with a breech, power is off, and she's in second stage. So there was really a lot of struggle to ensure that we conduct this delivery successfully. The only light which I had at that particular time was just a little light from a small phone. Ideally, this light was not enough, but we struggled to see that we maneuver to deliver this baby successfully. But unfortunately, the baby was delivered with a very low score. So in that darkness, we struggled to look around, to look for the resuscitation equipment, to see that we saved the baby, but it was not possible because the light we had, it was very little. The baby is severely asphyxiated, not breathing well. Remember, the mother is also there bleeding. It was really challenging. So from that time, I knew that having light at birth is really very, very vital. Because if we had enough light at that time, maybe we could have saved this baby's life. But unfortunately, we couldn't, because she came in second stage with a complicated delivery. There is no light, we are in darkness. So from that time, I came to learn that light is really important at birth. But since from the time we partnered with We Care Solar in Uganda, we have actually transformed some of the mothers' lives, because light in some facilities is always available. I'm one of the beneficiaries who received a solar suitcase from We Care Solar. When light has gone off, all power is off, I'm not even scared at all, because light is always there. We conduct our deliveries normally, and even mothers are able to access this service at any time because there is light. So having light at birth is really paramount to transform the mothers and babies' lives. Thank you so much, Debbie.
Oh, thank you so much, Sarah. You know, from that really sad, unfortunate incident that you have shared, I like that you've been able to share the impact of the solar suitcase in your life and therefore in your work, and therefore you're showing us how past experiences hopefully will not happen again. Thank you so much. Now, we need to start thinking about how we are sustaining this work. I'd like now to shift our conversation. Thank you, everyone. How are we sustaining this work? Julie and Samantha, I'll start with you, Julie, but please pitch in, Sam. What strategies have been most effective in ensuring that these solar-powered solutions are community-driven and are therefore able to be sustained in the longer term? Julie?
All right. Thank you very much, Debbie. Yes, so our community are a key components of our installations. This is because they are the beneficiaries, the first line beneficiaries of the solar suitcase. Then in the angle of ownership and sustainability, as soon as we put it in the facility, it becomes their property for them to protect. So one of the things that we do is that as part of our cascade of events, or as part of events that happen on the day of installation, our first point of call is our village development committee or our ward development committee. So we invite them to come to the facility because they play a very critical role in ensuring that services that are being offered in the facility, the community is very much aware of these services and can access these services. So they need to know firsthand the service that we're bringing to the facility. So yes, we bring them on board, we introduce the solar suitcase to them, and in all cases, because I wouldn't want to say in more cases than none, in all cases, we have seen them embrace the solar suitcase, welcome it, and even commit to protecting it, commit to ensuring that the healthcare workers use it well, commit to ensuring that there is routine maintenance of the solar suitcase. And then they also create a demand for it. You see, because as part of the World Development Committee, there's a women leader in that committee. So it's her role to go back to the community and tell her women that there is reliable power now in the facility, you know, and you can access the facility any time of the day. On the other hand, the healthcare workers too are excited, they are motivated, they have been told by the community that if we see the light off in this facility any time of the day, we are going to come and inquire. You know, most recently we met His Royal Highness for Jiwa Emirates. We met him last week. He used to be a community health extension worker. He's so enthusiastic about ensuring that healthcare services are rendered free, at least to some levels, and the within his community where he is overseen as the Royal Majesty there, he ensures that they get the quality services. So you could see him, he was with us that day, he invited us to his palace, and he began to tell the facility and even the community people that they need to do all they need to do to ensure that it is functioning in its utmost capacity. You know, that brings us joy. We leave with the confidence that the solar suitcase is going to be well used and it's going to be maintained, and it has been taken on by the community, which is also a sustainability model for us. Thank you.
Okay, thank you so much. And I would like to remind our dear participants, if you have any questions, anything, observations, additional information, please do not hesitate to share in the chat. And we'll, of course, give you some time to interact with us at the end of this panel discussion. So, Sam, before we get into the community, what does We Care Solar do? What is the most important step taken before we get to that community level that Julie has talked about?
Well, what I was going to talk a bit more about was about the partnerships and how important partnerships are to not just the installation. The installation phase is one part of what we do. What we consider as equally important is the sustainability and maintenance of the solar suitcase. So I'm extremely proud when I hear stories about nicknames that the solar suitcase has been given by health workers or in the health facility. You know, we really rely on our little baby solar, you know, or we love our yellow suitcase. Because it shows that level of ownership that each health facility and the health workers in the health facility have for the suitcase. That directly translates to how well the suitcases are taken care of and maintained over time, which means that we will see those suitcases perform for their full lifespan. And then it becomes a numbers game for how many women and babies the suitcases can impact over time. The longer they're operating, the more, you know, the better they're maintained, as is that impact, seeing how many women and babies the solar suitcase can impact. So the partnerships are critical to that, having the government involved at multiple levels, as Julie mentioned, and also our work with the private sector. As Gloria has mentioned, Helen has mentioned, working together with the private sector has been also very important to the overall sustainability and maintenance of the programs. So I think it's all shows a lot that it's all very interlinked. Right. And that's going to make sure that those solar suitcases last for as long as possible and provide light and essential power for as long as possible.
Okay, so I'm going to move faster because I want to give the participants an opportunity to engage. And Gloria and Helen, please, would you share how training and engaging women in solar solutions have changed community perceptions about gender roles and leadership? Gloria?
Okay. Yeah. Thank you, David. I will say that before I answer that question, I would like to say that as an installer, I relate directly with the healthcare workers and the community. And I tell you, you need to see how much laughter and joy Wikia Solar has brought to these people. Not just the women, but the community as a whole. Wikia Solar has brought so much joy and laughter to these communities. And then talking about perspective, it has not only changed their perspective, it has changed their mindset. Now they see that women are not just baby producing machine. And they see that these women, if given the opportunity, we do well. I tell you, we go to these facilities in hard to reach areas and we tell them we have come to install solar for you. And they look at us and they wonder, these are women, you know, but I and my team will get to work. Some on the roof, some on the ground, and we are working. And by the time we are done working and switch on the light and light comes, wow, they forget we are women. They're excited, they are happy, and wow, they appreciate us and appreciate Wikia Solar. So I want to say that it has not really changed their perspective. It has changed their mindset. And I tell you that those in the people from those communities that we have visited, I am sure, you know, when we walk, we hear them whispering, these are women, wow, wow. They are amazed, you know, and they are challenged, even the youth, they are challenged. They come to gather to see us walk. You need to see, you know, we are excited. We are really excited. We are doing this installation. We are proud of it, and we are really proud of Wikia Solar, what Wikia Solar is doing. You know, the people gather, they watch us climb the ladder, they look at us. So I know that nobody from that community will withhold any lady or any woman from coming out to want to be an installer. No, because they've seen us, their challenge, their mindset have been changed, seen us work, and seen the light come. It's like, this is the solution to our problem. So I tell you, it has really changed their mindset.
That's amazing. You know, you're building a whole generation of role models who are modeling the way for other women and girls and just lighting up every birth. Wonderful, Engineer Gloria. Helen, do you have any other examples?
Yeah, but let me just
Yes, Helen?
let me comment on bodies. Yeah, really feel her, especially when sometimes you go to a site and the people around you are saying they're women. I remember there's a place we went to and a young guy, I don't even know how he saw this. He was like, look, she has chin hairs. Which was a bit funny. I think it's just that they were so amazed that women could actually set up solar systems in that area. And the interesting thing sometimes is when we go to communities is the community is literally waiting for you to fail so that when the lights come on, they're like, oh my gosh, the lights are actually working, they did it. And then it sort of like wipes away this perspective they had that women can actually work in STEM and do a job successfully, because now you've done it and you've done a good, neat job, and the system is actually working. For me, I think some of the things that have stood out the most were once when we went to a border town community, and with many border town communities, sometimes they're left, they can be quite, at least in my country, they can be quite marginalized, and not enough resources in that area. So you'd find that they're also very the local culture can be very patriarchal. So we went to this school courtesy of We Share Solar, which is a sister organization to We Care Solar, and we were setting up solar panels, and the parent teacher association chairman literally left his house to make sure he saw with his own two eyes that there were actually women on top of a roof setting up a solar panel. Why was this? It's because in that particular area, the culture, the community did not allow women to have anything to do with building, anything to do with building. Into construction were always left to men. So even for us, it was shocking to learn what's happening. And my final example would be in a different community in the northern part of Kenya. They're called the Samburu. So the Samburus are a nomadic community very similar to the Maasai, and they are responsible for constructing the house. So that's the opposite of wherever we were. These women, when we were installing solar panels on their houses, they were so curious. I kid you not, like they wanted to be involved in this, in everything, setting up the solar panel and dropping down the cables and setting up the battery. And they would even give us hints like, no, don't do this. Use this rock because it's going to be better. And my heart in particular, and even some of the women we were with, our hearts would have like your heart would almost cry, wanting to give them as much as you can so that you empower them and leave them with skills that will help them set up more. And to lighting with this particular Samburu group of women is that they had insisted over and over again that they wanted a solar panel because they were creating a semi-permanent structure where they could train their kids during the drought season, because the way that community is set up, during the drought season, the men would take away the cattle, the goats and the cows to fertile places to look for water and pasture, and then the women would be left with the children. And they had insisted, it made us actually go back to they insisted so much that we had to go back to that area to set up that panel. So it's some of these things that you see that move your heart in a way that makes you want to, like, you almost wish you could give your everything to the communities that are in need. I feel I've taken up a bit of time, but thank you, Debbie, for allowing me to share that.
Okay. So I would really love to give our participants a chance to interact with us. And so I'm going to move much faster. I would like us now to start envisioning, reimagining the future. We're now talking about the Beijing Declaration and Platform for Action at 30 years. 30 years. So what does the Beijing Declaration and Platform for Action framework of 30 years mean to We Care Solar as we think of the next 10 years? Because then we'll be at, I think we'll be 25 years. So how does all this look like? We Care Solar at 25. Beijing platform, within the framework of the Beijing Platform for Action at 40. I would like to start with you, Laura and Samantha. Could you just share some views quickly? Just 1 minute each, because I really would love to hear from our participants.
Sam, you want to start?
Sure. I think that what's amazing is the progress that we've heard today. We've heard so many stories of progress, But I think we also know that progress can sometimes be fragile, particularly when it comes to the progress we've made with women and girls. So I think we still have a lot of work to do in our minds. Julie spoke about the installers and the female installers. Gloria talked about her experience, and Helen. And we want to see at least 50% of our women, up on the roof installing the solar suitcase. So we want to continue to provide the environment and the ecosystem to make that happen and to help break down those barriers. We want to continue to see gender balanced teams that are driving innovation and decision making. And we want to make sure that all women continue to have the utmost dignity during childbirth and assisting childbirth. And I think we envision that world. We know that there's a lot of work to do, but I think as long as we can see progress forward and measure that progress, we will continue to be happy with the progress and the opportunities that we're able to provide to women through the work that we're doing. Laura?
Oh, thank you, Samantha. You know, when we started this work in 2010, there were really not a lot of organizations that were focused on the issue of renewable energy for healthcare. And as I mentioned at the beginning, women are dying during what should be the most joyful time of life, which is childbirth. And the health workers who are charged to take care of them are being asked to try and provide care when they can't even see what they're doing. And we really believe that every health worker is entitled to reliable electricity. And now there are lots of people on the ground who are taking this cause seriously. There are many more efforts that are focused on renewable energy for all, including for healthcare. And in the next 10 years, I think it really is possible to prioritize healthcare in the march towards sustainable energy for all. And I would like to see that every health facility, regardless of where it is, has reliable electricity, and we have sustainable power, which means you don't need to rely on the infrastructure of electric grids. You can have distributed power wherever a health facility exists. We've shown that that's possible. And what's really important to us at We Care Solar is that as we work towards renewable energy for all, that women and children are really at the front of the line, that these services are so crucial for healthy communities, for healthy futures. And so we must prioritize maternal newborn care as we look at healthcare in general to extend services to every area where communities are continuing to thrive and where women are continuing to give birth.
Mm-hmm. That's important. And Sarah, what is your call to action, as you reflect on all this and your experience?
Thank you so much, Debbie. I actually think that if Solar We Care can ensure that every facility gets a suitcase to access light at birth, that would be very important. Like for our case, we have, in my organization, we have like 700 facilities based in the communities at the grassroots level. But so far, only 20 facilities have received the solar suitcases. So we are arguing to the team to at least to support us, and every facility gets a solar suitcase, because being that we are based at the community level, mothers come to us first before they go to those bigger facilities. So that would be very, very grateful if each facility can receive a solar suitcase. Thank you, Debbie.
Thank you so much for reminding us of how big the need is. So there's a lot we still have to do. We're still in business, okay? Okay. Yeah. So Helen and Gloria, I would like to hear your final words on what advice you'd give to young women interested in pursuing careers in solar energy and health. I'm giving you 30 seconds each.
For me, I would say that I would tell the young girls not to be afraid, be focused, and to believe that they can do it. I tell you, once I was up the roof walking, and my husband called me, and I told him, your wife is up the roof. So, and we both laughed. It's a wonderful thing. So I encourage the young girls to believe that they can do it, not to allow distraction from their male counterpart or fellow women. Growth is a process. Gradually, they will get to the goal. Thank you.
Thank you, Gloria. And we celebrate that very supportive husband.
Thank you.
A male feminist. Okay, Helen? Any last words? Helen? Julie?
Yeah, I think,
Okay.
yeah, if you can hear me. For me,
Yeah.
I think it's just to reiterate for young women and girls and anyone interested to do it afraid.
Yeah.
Just do it afraid.
Afraid.
All the what ifs you have in your head, answer those questions while you have already started the journey. Yes, I think that's it. And ask for help where you need help. Thank you, Debbie.
Thank you, Helen. You actually reminded me of one of our mantras in G4G. Do it afraid. Just do it afraid. Okay, Julie, any last word?
Yes, so clean energy is a game changer. And it's also a powerful solution in the maternal and child health space. And women must lead this transformation. By empowering women as clean energy providers, we are not just providing light, we are saving lives. And I think that once we know that that's exactly what we are doing, it will change the whole thing that we are doing. Thank you.
Hey, thank you so much, Julie. I'm really so grateful to this amazing panel. A round of applause for all of you. I would like now to open it up to our participants. I'll need some help in monitoring the chat and any hands that may be up. Benjamin, sorry. I see Benjamin, in addition to involving female gender while doing the installation, this has increased confidence within the midwives. Okay, so that's an observation. Thank you so much, Benjamin Kayanja.
I just want to comment on that if I could, which is that really was part of the impetus for bringing women in as installers early on. We found that when we were going into health facilities, initially we only had male installers. Women were giving birth in these rooms. We had to send them out every time there was some activity happening. And we realized that it was going to be a lot easier, number one, if we had women doing the installations because they could be comfortable in these very private places with other women. But also, we wanted to reduce the stigma that solar power is really a male thing. And so when women were teaching other women, it really was a great opportunity for women to feel like this was something that was accessible to them. And we would say, look, if we can do it, you can do it too. So this woman-to-woman type of training, I think, was really one of the initial thoughts behind us beginning a Solar Ambassador program for women, which started in 2012.
Okay, thank you so much. And I have a question from Anne-Marie. Who do you see as the critical allies to achieve this next 10-year ambition and to safeguard the existing achievements so that they are not eroded? Any of our panelists to answer that quickly?
All right, so as soon as I saw that question, the very first thing that came into my head was men. Yes, we need men as our allies, not because we are in any competition. Like I tell my daughters, you know, there's a popular saying that says what a man can do, a woman can do better. No, it's not a game of who is doing better, but it's a game of you telling yourself, I want to be better, not because I want to be better for the man or for the boy in your class, but because I want to be better than myself than I was yesterday. And we need the male or the male gender or the men as our allies. They have been in the forefront of the renewable energy space. We need them to stretch that hand of partnership for us to hold on to their hands and be on the front line together. Thank you.
Okay, great. Do you see any other question or observation?
There is someone with a raised hand. I'm gonna
Okay.
see if we can view her.
Okay.
Let's see. Can the person who raised their hand begin speaking? I don't know if we'll be able to hear you, but it looks like right now we, if you unmute yourself, we should be able to hear you.
Zaharadin. Zaharadin, please
Yes.
unmute.
So he's one of our installers in Bauchi State. I really wish he could speak because he's very enthusiastic.
Hi, Zaharadin. Can you hear us? Please unmute. Please unmute. Would like to hear from you. Is there anybody else with a question?
It looks like he's unmuted now.
Hello.
Yes.
Hello, can you hear me?
Yes, we can.
Good afternoon, good morning, and good evening to you. So I really appreciate what I saw. And then what Dr. Julie said that we here bring light to facilities, but it's not only the light, as he said, it saved the life. Because we even went to one facility, we found there is a patient on the facility. They said that they need more light. We gave them the headlamp. They use it. They really appreciate it. Since before we finish the installations, they really appreciate. They even pray. The majority of them, they really appreciate what they saw from the Wikia Solar. And opportunity yesterday, we even visit some of the facilities that we have been installed last year. And the feedback that we have been found from them, they really appreciate, more especially that fetal Doppler infrared thermometer. More especially that fetal Doppler, they say that during its work, they even found some issues of tachycardia. They referred them directly to secondary hospital like General Hospital and the Teaching Hospital in Azare here in Bauchi State. And later on, some of them, they said, based on the charging their phone, like one village that we visit in Shira local government, the facility in charge said that once you want to charge her phone, she even spent for about 500 naira for only charging. She gave the 200 naira for transport, send it to charge, and 200 naira send it back to her, and 100 naira for charging. And by now, she said that she don't have that problem. And the majority of them, based on that visiting that we do yesterday, they say that their birth rate has increased. Some they say from 40 to like 80 to 70 birth per month, and they really appreciate. They even pray for the Wikia Solar, and even we installers, we even see happy from them, and even from the community in general. Even me as an installer from Bauchi, I can say that I really appreciate what Wikia Solar did in my state and in my nation in general. And based on that gender equity, there is one time that we went to installation, and the village people, they saw us together with one female in the roof. They said, see Aljana. That Aljana means she demon in Hausa. They said, see Aljana in the roof. And that Angela is a female installer in our team, and she even really do many things. When she is working, you maybe see that maybe she's not a female, or she's looking herself as a male like us. And I don't have anything to say, but I really appreciate, and many people in community and the rest appreciate, and even the health workers, they even think that, see the female doing the work of males. She's climbed the ladder, see her on the roof, see her on the ceiling, see her very busy. Many of them, they say that if possible, they like to be with us. Many of that are females are health workers. Thank you, Ukia Solar in general.
Thank you very much, Zahara Din. And we also have a question. Christine's hand was up. Okay, Benjamin Kayanja. Then we'll take Christian's. Yes, Benjamin, over to you.
Thank you so much, Debbie. Hello to everyone here on this platform. Thank you so much for the invite. So it's a very good thing that We Care Solar is involving in female in this project of lighting every birth. I see we are majorly looking at saving life and try to light up every facility that conducts deliveries. But I see an advantage with that comes with these installations or involving in female while doing the installation. I have seen very many of us try to fight so hard with our health. So involving female in doing installations, you're going to find health-wise they're improving. So you find someone is doing a lot of exercise as they climb up on the roof, as they go down, as they run cables here and there, you find that your heart is really working so well. So I am very sure that as we are hitting a stone, as we are throwing a stone to save lives while doing these installations, even our health as females who have involved ourselves in these installations, trust me, our health is also improved. So this is one thing that we may be benefiting one way or the other, and the impact will always be coming out. I'm sure about that. So I think as one is fighting so hard to try to go in the gym to do exercise, this is also going to be helping much of the females. Thank you so much.
That's a very interesting insight, Benjamin, about the lifestyle changes that are happening and, we're becoming healthier and healthier. So, Christian, you had a question. Christian, your hand was up. Are you ready? Okay, Christian.
Yeah, I'm quite interested in how you're collecting and leveraging data because I've been working on the same project, electrification for healthcare project in East Africa, and DRC, and currently working on digital transformational development at UC Berkeley. So one of the biggest challenges that I see most enterprises face is using data to communicate the impact, what they're doing, because they're doing great work on the ground, but when it comes to raising funds, it becomes a problem. It becomes a challenge. So how are you collecting data to communicate all this work that is amazing women are doing on the ground? And yeah.
Thank you for the question, Laura.
Thank you for the question. We have actually collected different types of data over time, both qualitative and quantitative. We've done research to really understand how electricity impacts health workers and the work that they do through qualitative studies. We've done interviews with, I think, more than 600 health workers in more than 10 countries and reported on that. We've also done quantitative data to understand how do the number of deliveries change over time? How are the solar suitcases working over time? What are some of the changes in the referral patterns? One of the things that we have found is that in some of the lower level facilities, they are better equipped to deal with problems and not as likely to refer patients to another facility if they can handle it in their own facilities. So we see that the referral patterns are more appropriate. We look at the kinds of care that are being able to be provided for. We look at things like whether or not care can be done in a timely manner. Harvard and Innovation for Poverty Action worked with us on they actually did a randomized control trial in Uganda that was using clinical observers within the health facilities to try and understand how care changed. And one of the things they reported on was the improvements in the timeliness of care. There were not as many delays in care, and they also were able to provide a better array of quality of care because they had light and power to do what they were doing. So we've done in-depth studies, and then on an ongoing basis, we look at things like the change in the utilization of the facilities, how many patients are being able to be cared for. And just like one of our attendees mentioned, we do tend to see an increase in the number of skilled deliveries when a health facility is equipped with power. In addition, we now are working with some automated systems where we're giving installers the capacity to report on how the solar suitcases are doing over time. And as Samantha was mentioning, we're doing deeper dives into sustainability and maintenance, where we're trying to track how solar suitcases are doing throughout a country. We didn't necessarily mention that one of the things we do are national programs now under the banner of Light Every Birth. In Uganda, for example, we've reached 2,500 public health facilities. In Zimbabwe, more than 1,000, similar numbers in Sierra Leone. So we're trying to track quite a lot of health facilities with our technology. And so we have now created some systems, digital systems, for us to be able to track this over time. So I'd say we're both trying to look at quality of care, the quantity of care, and also how effectively these solar suitcases are being maintained over time.
Okay, thank you so much, Laura. And David Allen has a question. David, are you able to ask your question? David? Hello, David? You're on mute, David. Hello, David. You're on mute. Yes. Over to you.
Debbie, he's
Hi.
requesting, yeah, that we just read the question for him. So
Okay. What way forward do you see to meet the key funding constraints and obstacles that prevent meeting the enormous needs just in the healthcare space alone? I think that will be for Laura as well. Laura, in 1
I think
minute.
Samantha might want to address that one. Thank you.
Okay, Samantha, 1 minute.
It's a great question. Thank you, David. These questions are all just fantastic. So thank you, everyone. I think that, of course, there continue to be funding constraints. I think there will always be funding constraints as we address a need in the public sector, and that continues to cause challenges. But we've also seen a lot of progress over the last 10 years. And a lot of that has had to do with the advocacy and the change in the dialogue in the space from multiple stakeholders. So the government and donors and everyone that's involved. This has been elevated as a priority, much more so than 10 to 15 years ago. And I think that is definite progress. And we know that with that advocacy and with that additional dialogue comes additional funding. Obviously, right now, with the current challenges that are going on globally for funding, this will continue to be a challenge. But that's also where possible, there are many organizations working to better understand and translate the costs of other forms of energy that are not clean. There is a true cost to those. To a patient, to a woman delivering in a health facility, she's often asked to bring candles or to bring money to pay for fuel for a generator. Those costs are being displaced, as I think it was Benjamin that was talking about earlier. Everyone throughout this chain is saving money and replacing costs. We're trying to make sure that at the national government level, there is also this displacement and change in the way that that energy money is allocated, and how we're able to then also make sure that money is going towards clean energy and not just fuel for generators and other less clean alternatives. So those are a few comments, Debbie.
Okay, so thank you very much. And please note, there's some very, very interesting comments from Michael, who's getting on a flight. Thank you so much, Michael, for attending. Thank you so much to the participants. And I would like to close this very, very interesting session by inviting Maame, our chairperson, to give some closing remarks. And before I hand over to her, as we wrap up, I just want to thank all our inspiring panelists. Of course, our own keynote speaker, Maame, our beloved chairperson, our founder, Laura, amazing, amazing, and to all of us. Let's just congratulate all of us who came on board after Laura founded this amazing organization. For me, there are a couple of takeaways from the session. Clean energy is a gender equity issue. It's a human right. Every mother and health worker deserves a well-lit, well-powered healthcare facility. Okay? We need male allies. We need to work with the men and the boys, something that came through that wasn't so pronounced. We need to start looking at our family parenting practices. What are the messages we're sending to our little girls? Okay? Women must lead in clean energy, from installers to policymakers. Women's leadership is key to sustainable change. We need action. The technology exists, but we need stronger commitments to scale it. We need to leverage the power of partnerships and collaborations and the power of advocacy. So without much further ado, it's my pleasure to invite our esteemed chairperson, Maame Afon Yelbert-Sai.
Thank you.
Our closing remarks.
Yes, this has been so phenomenal. I've really taken a lot away, and I was just trying to put it in just quick nuggets because I believe that there are ideas that will stick. So here are the quick nuggets, and I want you to walk away as your medicine bag. Joy is critical in this work. Let's not lose it. Let's nurture it and let's cultivate it, because the work in front of us is hard work, but with joy, we can forge ahead with all kinds of power and outcomes. 2, in spite of everything going on, we are better off today than 30 years ago. So let's remember that. It's very easy for us to forget, in the midst of all the things going on, the turmoil and the confusion, it's very easy for us to forget. Let's remember we have come a long way, especially as women. And so we are better off than 30 years ago. Let's strengthen collaboration. That's the 3rd thing. And let's do this through intergenerational spaces. I'm looking at our space right now. It's an intergenerational space of voices, of ideas, the diversity of backgrounds, everybody coming together from different places. And I love this idea of strategic allyship with positive masculinity, with our men, with our husbands. I do the things I do because I have a man that I call a phenomenal feminist African man, because if you know who I am and you know where I sit, it's because my husband understands it and gets it. So we pray for more of those. Also, we are equipped to navigate these times. We are built for it. So let's be encouraged. The things, the skills, the experience, the lessons, all the things that have shaped us, we are built for such a time as this. So be encouraged. Do not lose hope. Keep hope alive. And then also, community is power. Let's sit in it and continue to tell our stories. I recently came across a word that one of my mentees is using. She calls it sustainavate. And so we are sitting at the intersection of sustainability and innovation. So let's go and sustainate, or sustainavate. One word, hashtag that. And when you are passionate about something, do something about it. That was the word I used at the end, that what will you do to brighten and light up the corner where you are? And as we think about all of this, I know that resources are always a big part. But one quote that I love is that if the cause is right, the means will come. So let's be encouraged with these words. And thank you all. Thank you, Laura, for your vision, for your leadership. Thank you, Samantha, for your vision, for your leadership. Thank you to the We Care Solar team, because this is an Ubuntu movement we are building. We all are, because each one of us understands what we are doing and why we are called to do it. And thank you to all the people who shared. I was really moved by the gentleman who was just sharing about, from Bauchi and the women doing the work. Each one of you, all our panelists, I see you. We say Sawubona. God richly bless you all. Thank you.
Thank you, Maame. Thank you, everyone.